So this is the second part of that last question on chin implants. Frequent question that a lot of patients ask is, once the chin implant is in there, what keeps it from moving around? Do I have to be worried about it moving later on?
Yeah, it's a valid question, but thankfully the answer is relatively simple. And unless you have some real major trauma, these implants really don't move. There's two different types of implants that most surgeons use. We prefer the silicone implants. With those, you get a capsule formation around the implant, and that basically holds everything exactly where you put it. It does take a little bit of time for that to form, but all of these implants basically sit under all the soft tissue, just on top of the bone. We typically will throw a couple of sutures in there to hold things in place until the capsule forms. In the meanwhile, a good surgeon will keep the pocket relatively small, so there isn't a whole lot of room for this to move around and do anything. The other type of implant is a Medpor implant.
Yeah, so Medpor, or those types of implants, allow the tissue, as it's healing, to actually grow through little tiny pores in the implant itself. The idea behind that is it's supposed to stabilize the implant better, at least theoretically, and hold the implant in place. We find, though, that those implants can be problematic. So because in the few cases where, for some reason, someone wants the implant to be removed, or they had a car accident, broke their jaw, need to have the implant removed, once the tissue grows into that implant, it can be more problematic to remove the implant without causing any little bit of tissue loss, some dimpling or other kind of superficial issue with the skin after.
That's exactly the point. With the Medpor implants, theoretically, if somebody actually needed the implant removed, you're going to have to take a little cuff of tissue along with it. Whereas with the silicone implants, you're making a cut into the capsule, and the implant comes out relatively easy. So, simple answer to your question: once the implant is put in good hands with a small pocket, there's almost zero chance of the implant